And then those excitotoxins, anything with MSG, but natural flavors is MSG, anything with monosodium glutamate, sulfites, nitrites, high fructose corn syrup, red and yellow food dyes, that whole thing. But like my really picky eaters, it just gets hard because we're like low, low glutamate, low histamine, low oxalate, low carb, but then, we don't want to get too much protein because they're not, their kidneys are getting a little wonky. So my heart goes out to the families trying to feed these kids with these eating disorders.
Welcome to Demystifying PANS and PANDAS, the podcast where we uncover the mysteries, breakthroughs, and hope behind these life-altering conditions. I'm Dr. Nancy O'Hara, a board-certified pediatrician, educator, and advocate with over 3 decades of experience helping children and families navigate the challenges of neurodevelopmental and neuropsychiatric conditions, especially PANS and PANDAS. These disorders can feel overwhelming, but here we'll break down the science, explore transformative treatments, and share stories of resilience and recovery. If you've ever wondered what's possible for your child or how to find answers, this is the place to start. Let's dive in. I am thrilled to welcome Dr. Anju Usman-Singh. Dr. Singh is director and owner of True Health Medical Center and Pure Compounding Pharmacy in Naperville, Illinois, and she serves as the chief science officer for family-owned nutraceutical company, True Healing Naturals. She specializes in all the biomedical interventions for children with ADD, with autism, PANS, PANDAS, Down syndrome, and all related disorders. And she's been involved in research regarding copper-zinc imbalances, metallothionein dysfunction, biofilm-related infections, hyperbaric oxygen. And she serves on medical advisory boards, Documenting Hope, TALK, Autism Hope Alliance, and of course, the executive board for the Medical Academy of Pediatrics and Special Needs. And Dr. Usman-Singh received her medical degree from Indiana University and completed a residency in family practice at Cook County in Chicago, Illinois. And she's board certified in family practice and holds certification in homeopathy and integrative medicine. And that doesn't even scratch the surface for how remarkable Dr. Usman-Singh is. And I say that, I know she is way too modest to totally agree with me, but Dr. Usman-Singh is one of the most brilliant women in this field and certainly a pioneer in all of this research and everything we do for our kids with special needs. So thanks, Anju, for joining me.
Oh, I'm so excited to talk with you and your group. And I kind of think about our journey together. And I feel like you've been on this journey with me this whole time. And I'm just fortunate to have you by my side as well. And I feel the same way about you.
Yeah, I remember the first time I heard you lecture, I was just, I'm not usually blown away by other people's lectures. Like I'll take pearls, all that kind of stuff. But I was blown away by your lecture. And I just, not only your head, but your heart are just so golden for everything we do in functional and integrative medicine. So anyway, all right, enough accolades. One of the first things I learned from you actually was about biofilms. And, we both agree that the gut-brain connection is huge. And as I always say, the gut isn't the second brain, it's the first brain. But let's start in all this gut-brain connection stuff. Because we have both parents and practitioners, hopefully, listening and learning and watching, what are biofilms?
So they're actually what they sound like. They're just a film material, and they just coat things. So you have a natural biofilm in your mouth and your whole GI tract. You wake up in the morning and you can kind of feel that film around your teeth. And that's what we call like the glycocalyx. It's just a natural biofilm. But when we have chronic infections, sometimes those infections can say persistent or chronic, and they hide under these films. And the films are called biofilms, and they're pathogenic because they allow these infections to stay in the system and evade the immune system.
Yeah.
And so they're when we're dealing with, and you talk a lot about these chronic infections that are triggering immune activation, and even chronic infections can trigger mast cell activation and things like PANS and PANDAS. It's a big problem for a lot of people with chronic issues. And chronic antibiotics isn't always the solution. So addressing these kinds of pathogenic biofilms can be helpful.
Yeah. Yeah. And I remember when I first started doing this, Sid, Dr. Baker, was one of my major mentors, and he was always using prescription antifungals, prescription antibiotics. But when I started using the biofilm protocols with herbs, that's when I really started seeing improvements.
Yeah, I started looking at this in 2007. I remember going to my daughter's dentist's office, and they had this biotin biofilm degrading mouthwash. And I'm like, what's biofilms? And then I started looking at it and talking to all of you guys about it and coming up with these concepts based on the literature. And so these films are just a mucus. And if you think about mucus, they're very watery and they're made up of carbs. They're like carbohydrate. And there's a little bit of fiber and just kind of stuck in between them to hold it together. But what really holds those films together are what we call cations. So calcium, iron in particular, and magnesium. And you think about some of our kids and you think, oh man, they're really low in calcium, they're low in iron, they're low in magnesium. But my theory is that all those minerals are hiding in these films to protect these bad infections. And when you open up the film, sometimes in my patients with these like really low ferritin levels and low iron levels, I start opening up these films and it just releases that iron. But it's really like, it's like a fortress. I think of it as like a fortress, like all around these bugs. And it's really hard. It's hard. And it's made up of these heavy, these like metals. And so, the strategies are to kind of open that up a bit.
Right, right. And the other thing that I think is important for everybody to realize is these biofilms also prevent us from finding these deeply buried germs, so to speak, when we do cultures, et cetera. People always like, well, it can't be a yeast infection because, nothing cultured on the stool, or it can't be parasites or Clostridia or whatever it may be. These also prevent us from effectively growing this in culture.
Oh, exactly. I mean, they've done studies on this and they found that they can't really culture them. So you go in there with your swab to, swab your throat and try to get that strep culture, and nothing shows up, and you have all these, like red flags. I've got strep, or my patient has strep. And then I'd, really seriously think that that particular infection, like a strep infection, does hide under biofilms. Things like Lyme. There are certain bugs that are more likely to do it, like MRSA, Pseudomonas. And so these films, these mucousy films, these new PCR tests and the next gen sequencing kind of stuff, they can pick up some of the DNA.
Right.
So those might be a more helpful kind of look, but then you get a whole bunch of bugs and you sometimes don't know which ones are real and which ones are the bad thing. I mean, I even like if I'm looking for strep, I like to do the rapid and a culture, because the rapids will sometimes show because they're looking for that antigen and not culturing out. So sometimes you'll see it on that. And I just tell people, like, if you guys are doing like stool tests and looking to culture like things in the gut for dysbiosis, what you really see is the tip of the iceberg.
Right.
What you're really seeing. I mean, if you see a 1+ yeast or a candida or rotavirus, I would go after that, because it's just sitting on top. You're just getting the top layer. I used to do these like little experiments, and I did like stool tests on patients, and then I gave them like my biofilm type protocols. And then I repeated the stool test. And the first stool test, that when we were looking for like dysbiosis, I would see like 1 or 2, 3 bacteria. And then I repeated it after I opened up the biofilm. I'd see like 15.
Exactly.
It was like, it just like blew me away. I was like, oh my God, that's all really in there. It's all in there. And so, I think those cations that hold that biofilm together, and again, this is a theory, but I think there's lead and aluminum and heavy metals in there too, especially in our metal toxic people. So when we kind of go through these films, we're opening up a lot of stuff, and we have to kind of be a little bit careful as well, because then the bugs that are under those films, like bacteria, but there could be parasites, they could be viruses, there's fungus. And so the immune system is all of a sudden saying, "Ooh, look here." And, our patients can kind of look like they're getting sick, but they have been.
Right. It's just the body is such an amazing machine that we don't want to be sick with these chronic infections. And so we trap them, we house them, we hide them so that our bodies are not acutely ill. But what we're seeing is all the chronic health issues and chronic infections because of that, right?
Yep. And I think our bodies do, when we can't handle something, our bodies can figure out a way to protect ourselves. And I think that we do that, we hide the toxins too, like mold toxins are hiding, and and heavy metals. And when we kind of look for them, that's the tip of the iceberg.
Right.
For
right.
people with
So,
chronic illnesses.
what interventions do you consider or do you use in addressing this chronic biofilm related infections?
So first of all, kind of, you want to have a suspicion when you have a patient with chronic infections like chronic UTI, sinusitis, otitis, pharyngitis, recurrent SIBO, recurrent dysbiosis. So any of those patients, you just like, ding, 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 there's something going on here.
Yeah.
And then what do? Well, if you're already looking at hitting those microbes, like I know you use a lot of herbs, and I like to use herbs because I find them very complex. And antibiotics, the immune system can figure out how to evade them easier, but they don't give you instant gratification. So I'll go there with the herbs, depending on what my suspicion that, what we're dealing with. But if patients are doing better, then I say, to prevent this from coming back, let's add in this biofilm, degrading type protocol. Some people are super sensitive, so I kind of like to ease people into those kinds of things, like I mentioned, because they're opening stuff up. And so there's different strategies. There's, I always say, there's the like less aggressive to more aggressive. So like if you think less aggressive, you can do some natural things. So less aggressive would be organic, like very mild acids, like apple cider vinegar.
Yes.
Is a very nice, like mild or acidic compound. And it does have a gentle kind of biofilm busting. And a lot of people like take apple cider vinegar to cleanse their gut. And really what they're doing is they're like dissolving a little bit of that biofilm. And so I like a teaspoon of apple cider vinegar with like a little bit of honey just for taste, and then some lemon. The citric acid, even things like malic acid, citric acid, glycine, they have these little ability to kind of break down films as well. And they also help with kind of oxalates, especially the citric, so the lemon.
Yeah. And in really sensitive kids, I've started even with drops of apple cider vinegar, up to a teaspoon, but some of them, react even to that little amount.
Yeah. And another simple strategy is green tea. I like matcha in particular. That's another one that's been shown. Because things like, green tea and then curcumin.
Yeah.
If you think about curcumin, if you have a patient with like low iron, you're not supposed to give them curcumin because curcumin kind of binds iron. That's why it helps the biofilm.
Right.
Because it pulls the iron away from the biofilm. So curcumin, green tea, some of these, and then spices, especially like the oils. Like some people are into essential oils, but the oils in these spices, they penetrate films, and things like oregano, thyme, sage have been shown to be helpful in dissolving these. But those are simple, or I'd say more gentle strategies.
Yeah, and we also use those oils, in diffusers, like thinking about our kids in musty or mold homes. Those oils are also great just for inhalation, as well as, like you're saying, ingestion with the oil of oregano, the thyme oil, etc.
Yeah,
So,
yeah. What kind
yeah.
of oils do you use in the moldy kind of? I
Well,
know.
the oregano certainly, but
Yeah,
thuja is great just as a detoxifier, thyme, rosemary. Those are the ones that I've seen the biggest
yeah.
effects with.
And those
So,
have been studied to
yeah,
penetrate biofilms. So again, when you have these kind of chronic infections, I like that concept
yeah.
of diffusing these fat soluble compounds.
Yeah. The other
Um,
thing that I'm using a lot of is fiber, or modified citrus pectin or others. I think about you're breaking all this up. And I remember once you talked about, I think it was you, the toothbrush to come in and clean it up. And I
yeah.
see sort of the fiber, the modified citrus pectin is doing that.
Yeah. So when I talk about my protocol, it's basically 3 steps. Step one is you kind of lyse or degrade this film using these types of compounds, and enzymes are another way to degrade that film.
Yeah.
It's different than digestive enzymes. So digestive enzymes, you're trying to digest food, but these types of enzymes you have to take on an empty stomach so that you
Right.
get to the kind of the mucosa. And these are mucolytics.
Yep.
These are mucolytic type enzymes. And so step one is using like a mucolytic or fibrinolytic type enzyme. And one of my favorite substances for breaking films down is disodium EDTA.
Yep.
Now, people hear the word EDTA and they're like, oh my God, that's a chelator. And it is, but apple cider vinegar is basically EDTA.
Yep.
It is EDTA. It's just, it's like a kind of a version of it. It's in our mayonnaise. It's in a lot of things. There's never been an allergic reaction to it. Some of those enzymes are cultured in aspergillus. So some people are really sensitive to those plant-derived type enzymes.
Right.
So disodium EDTA is really nice. And I developed a product that has that in it. And I won't say that right now, but that kind of concept where you're having the enzyme with the EDTA is kind of my go-to for getting a little bit more serious with breaking down the films, and then doing it on empty stomach and then doing it like gently. So yeah, that's step one. And then two is those antimicrobials. And three is just what you mentioned just now, some type of binder,
Yep.
some type of binder to kind of bind up what you just kind of opened up. And like you
Yep.
said, it's like, fiber is, to me, it's just kind of like that toothbrush. It just kind of goes in and it cleans out your gut. And so I really like the soluble fibers.
Yep. Yeah, I agree. And what about stevia leaf extract? In some of the kids, I may start with that, especially when I'm looking at tick-borne disease, because although, it's not as good as your EDTA, your disodium EDTA, I do see some biofilm busting properties, plus taste, plus antimicrobial properties with the stevia. Do you ever use that? Have you ever found that helpful?
I have used it and I do find it helpful. And so those would be like, kind of for me, a lot of people I see have done a lot of these kinds of things and they're still
Yeah,
having issues. And so then, probably you too, like we have to kind of
yeah,
come up with, okay, yeah, we've done the stevia, we've done, these natural things. And so now like we're still dealing with this.
yeah.
But
But one
yeah,
thing,
I do like
Maureen,
the stevia. I do.
yeah,
It tastes
yeah.
good too.
Yeah, exactly. And when you said that, one thing that Maureen McDonald, our fearless leader for all those years in Defeat Autism Now and still going strong in this functional health world, she always said to me, whenever you see a child, don't go through the window, always go through the door. And one of the things that happens is people will come to us after being through so many interventions and they'll say, yeah, I did that. That didn't work. That didn't work. That didn't work. But sometimes it's either the dosing or the timing, the child wasn't ready for that yet. We had to decrease some mast cell activation or whatever, or it was the brand.
Yeah.
I certainly don't mind if you mention your brands because I think they're amazing and very well vetted. sometimes they may be using a product in too low a dose or not an effective formulation. And I think that affects it. So we have to keep that in mind, even when our families have gone through seems like every Tom, Dick, and Harry.
Every Nancy, Dan, and Anju.
Yeah, exactly. Exactly.
But I totally agree with that because I will sometimes tell people just to back off because we're so in that, I call it ER mode,
Yeah.
or we're in like this, like we're trying to run that marathon, or that sprint, and
Yeah.
back off. Because one of the things I see is that a lot of my patients, they're trying to detox at the same time they're trying to kill these microbes. And
Yeah.
sometimes, you have to do that. But if you think about it, you're pulling out these toxins, and then the biofilms love that stuff. And then you're just going to kind of like create or perpetuate a bit of an issue. It's kind of like people who say, oh, give me something for yeast so I can get rid of it.
Yeah. Yeah. I
And
so agree.
I just say, you're not going to get rid of it, but you can control it. And the minute I start detoxing you, it's going to kind of come back.
Yeah.
So we're going to have to keep addressing it for a little while till we can get your load down.
Yeah. Absolutely. And it is a marathon, maybe 3 or 4 marathons, but definitely not a sprint.
No.
So, thinking a little bit more specifically about pans and pandas, because we do call this podcast Demystifying PANS PANDAS. Why, and I so agree with you, but why is it so important to address gut health, dysbiosis, biofilm related infections, all of that when dealing with kids with the PANS PANDAS diagnosis?
Well, you know how hard it is to get the immune system to behave.
Yep.
And so, when we think of PANS and PANDAS, most people might think, oh, we just treat the infection and we're okay, we're good to go. But we know, you and I know, that this is an autoimmune condition, and that means the immune system is ready to take off at any time. And also, we know that 70% of the immune system pretty much is in the gut.
Yep.
A lot of those lymphatics, all those lymph nodes, neurotransmitters, a lot of what affects our kids with PANDAS is happening in the gut.
Absolutely.
More serotonin is made in the gut than in the brain. And, we can put kids on SSRIs, and we can put kids on things for their anxiety and their OCD. But if we don't address what's happening in the gut, I think we're doing them a disservice. So there's just a lot happening. And so we have to kind of take a look and see what's going on.
Yeah. And I heard you say on another podcast, it really doesn't matter what the label is. We get so caught up in the labels. This is an immune disease, an autoimmune disease, a lack of immune tolerance. But so is autism. So is, mold, tick-borne disease. So are so many of our illnesses. And it's really about the immune support, and that's really about the gut.
Yes. So anybody with any immune issue, they have a gut issue. And some people will say, well, I don't have any symptoms. And then, you and I will do like a urine organic acid test. That's kind of like one of my go-tos. It just gives me an overall view of a lot of things like mold colonization, yeast, Clostridia is a big one with dopamine. And a lot of those kinds of things really affect dopamine metabolism. And then I think if you think about our kids with PANS and PANDAS, dopamine is like front and center to like dopamine 1 antibodies, dopamine 2 antibodies, and how dopamine's moving around. So we need to know about that. And then another big thing is oxalates on the oats test.
Yeah.
So oxalic acid combines with calcium, and calcium regulation and PANS and PANDAS is another big thing when calcium, is flooding the neurons and stimulating glutamate and NMDA receptors and inflammation. So we got to get that all under control. So getting an oats test to figure some of those pieces out, I think is really helpful. And then I like looking at the microbiome. I just find it super, super helpful. I mean, some people do those comprehensive digestive stool analysis, and I will maybe start there just to kind of get, again, an overview that I'm not missing anything like high calprotectin that causes inflammation or a big inflammatory thing or maldigestion, malabsorption. But when I look at that microbiome and you see, oh, this particular bacteria, like say Prevotella corpori is a big one. This one should take up, I'm just making up a number. I don't know exactly the number, but you'll get the gist. It should be 0.4% of our population, of our gut. And it is 40%.
Yeah.
You can't see that on some tests, you need to be able to kind of quantify these things. Because
Yeah.
if it's 40%, and what they find with Prevotella is that it's associated with invasion. So if you have overgrowth of Prevotella, especially Prevotella corpori, it's associated with overgrowth of invasive species, like invasion of fungus, invasion of viruses, and it's also associated with parasites. So we don't know if it's a Prevotella as a problem, but it's these associations.
Yeah.
And so, there are you can see these subsets and then again, work on the gut piece with enzymes, prebiotics, probiotics if they can tolerate them, these biofilm strategies, various herbs and dietary interventions and constipation.
Oh, yeah. Constipation, if we don't treat that first, nothing else is going to work.
Mm-hmm. Yeah.
And what are you using to look at the microbiome now? I'm just interested.
Yeah, so I've gone through them all,
I'm figured.
I've gone through them all. I've done tests from Doctor's Data. I've done tests from Genova. I've done tests from Vibrant. I don't want anybody to feel like, okay, but I like the sRNA testing. Parents can actually order this on their own. People can order them on their own.
Interesting. Okay.
Yeah. Biome Site is one.
Yeah.
Ombre is another one. Tiny Health.
Yeah.
And so you can kind of get a really good idea of what's going on. The problem is a lot of these companies are trying to sell you a probiotic based on the test. So,
Right.
and they're not looking at the nitty gritty. And,
Right.
and a lot of practitioners, I know at MAPS, we try to teach these concepts, but it takes time.
It does.
It takes time to understand this stuff at a really deep level. And there's just a lot of practitioners that may or may not get it.
Right. And it's not static and it's not one size fits all. And it really has to be individualized, and not just because of the test, but also because of the child's response. That's only one test in time.
Exactly.
And the child's response makes such a difference. Yeah.
Yeah, that's what I find. I find like people, I don't know. I know when we first started in this world, our moms cooked food.
Yeah.
And
well,
we
your
talked
mom
about
made of. My mom never cooked food. My mom burnt biscuits, but I did learn that it was necessary. But yeah, I hear you. It's not, as Stu Friedenfeld always said, there's no such thing as junk food. It's either junk or it's food. And I think more and more we just have junk. But go ahead.
Yeah, but everything's so packaged and everything.
Yes.
And I see like those kids like eating out of all the stuff. And like when I think of the gut and healing the gut and figuring stuff out and treating the gut, the number one thing I think about is diet.
Yeah.
And I mean, everything's so packaged. And I have a couple of pet peeves. One of my pet peeves are those little aluminum lined containers that all the babies are eating out of nowadays. They're organic, but I don't know, I don't know how clean they are. Because I remember the Capri Sun days when we actually tested and we found aluminum and all that. And so when we're talking about the gut, I just had to throw in the whole diet thing because
absolutely.
I mean, I think it's like if I had to pick my favorite supplement, it would be diet.
I so agree with you. So agree with you. And, a lot of our kids with PANS and PANDAS will have eating disorders, will have ARFID, but it can still be done. Even little changes can make a big difference. And I think diet is so important.
Yeah, and it's so hard for these families. I mean, we get them on like casein-free diets because casein, gluten, right, are really high in glutamate.
Yeah.
And so like my PANS and PANDAS kids, I'm like, GFCF, come on, we got to
Yeah.
kind of go there. And then those excitotoxins, anything with MSG, but natural flavors is MSG,
Yeah.
anything with monosodium glutamate, sulfites, nitrites, high fructose corn syrup, red and yellow food
Yeah.
dyes, that whole thing. But like my really picky eaters, it just gets hard because we're like low, low glutamate, low histamine, low oxalate, then low carb, but then, we don't want to get too much protein because they're not, their kidneys are getting a little wonky. So my heart goes out to the families trying to feed these kids with these eating disorders. One of
I
my
agree.
simple strategies on that is to rub oils on their skin. We just talked about how oils are so important. I
Yeah.
remember when I was at county and I'd have some of those failure to thrive babies, and we would just like, even if you rub oil, you absorb some calories that way. And you
Yeah.
absorb those fats. And we're always talking about omega-3s, 6s, and 9s being so
Yeah.
helpful. So you can get some oils on them instead
Yeah.
of necessarily in them. And I love juicing, even this like little syringes of juices and things like that. So
Absolutely.
yeah.
And even with the oils, some of our kids are so tactilely sensitive, starting with just a little bit of oil in the bath if they're taking
Oh
baths
yeah.
and gradually increasing. And I want to reiterate to families, don't feel like a failure if you can't do all the wonderful things you should do and need to do. Just make one step. Don't
Yep.
not do anything because you can't do it all. Do something.
Yeah. Yeah.
Yeah.
And I agree with you. Like even a few drops of things. Yeah. I
Yeah.
tell a lot of my families too that we get so caught up in like these protocols and, like we have to do things a certain way. And then we go into that guilt mode and that throws out that negative energy and we're trying to shove things down our kids.
Yeah.
And
And what increases or decreases their glutathione more than anything is stress. I mean,
and I think
go ahead.
I no, I was gonna say I 100% agree with you. So I'd say I have this statement. I say intention is more important than technique.
Yeah.
So I mean, even I intend to do these things. I intend, but if you don't make it at the end of the day, forgive yourself.
Exactly. Exactly. Yeah. So agree. One other thing, Anju, that I've heard you lecture about a lot and that families ask me about a lot is SIBO and SIFO. And I've heard you talk about reducing bacterial loads and addressing carbohydrate metabolism and improving gut motility. Can you touch on either all of those for just a few minutes?
Yeah. So we have a large population in what we deal with autism of kids with apraxia.
Yeah.
So apraxia is not a cognitive issue or an intelligence issue. It's a motor planning issue. So if you
So
use
agree.
that word motor, what does motor mean? Motor means movement. And so they can't organize the movement to make words. Well, a lot of my kids with the speech issues can't organize the movement in their gut. And
Yep.
we have these motor complexes in the gut. Motor, they move. And if you think about how your gut moves, it's very synchronous. And
Yep.
if things aren't moving in a synchronous way, we get this, what we would say, dysmotility. They might be having bowel movements every day, but they're actually not emptying.
Yeah.
And so what happens is the bacteria from the large intestines kind of ends up in the small intestines because it's just not moving in the right direction.
Yep.
And it's almost like a reflux of that bacteria. And that what we call small intestinal bacterial overgrowth or small intestinal fungal overgrowth is really this translocated bacteria from the large intestines. Now in the small intestines, it's not supposed to be there and it's having a heyday.
Yep.
It just was like, oh man, there's food here. I'm good. I'm just gonna grow. And then in the process of growing, I'm gonna produce a ton of gas.
Yep.
A ton of gas. And the gas is methane, hydrogen, and sulfur.
Yep.
And they're toxic and they hurt. So a lot of our patients are in a lot of pain, but they might manifest that as aggression or behavior and not, they can't express that, oh, I feel gassy and bloated. And so if you have a client or a patient or child that has this, I always use the belly button as a point of reference. If the gas is above the belly button and there's lots of burping and bloating and you're flat in the morning and then bloated at the end of the day, think about this kind of bacterial overgrowth that might be making these gases.
Yeah.
And they're very toxic gases. Methane causes a lot of issues, especially with more constipation, and then we don't detox and things don't leave. Hydrogen causes like what you would consider a hydrogen balloon. I mean, it's just like, and it's detrimental to the brain as well. But one of the worst ones is, and they don't have a really good test for this, is hydrogen sulfide,
Okay.
H2S. So when you do the SIBO testing, we get the methane gas
Right.
and the hydrogen gas, but we don't get the sulfur gas.
Right.
There are new tests that you can do them on, and the microbiome testing does show the sulfur-reducing bacteria, desulfovibrio and biophilia, so you can kind of get a sense that way. But the hydrogen sulfide gas acts like a neurotransmitter, and it's not. So it creates a lot of confusion in the brain. And these people are super sulfur sensitive. So we want to detox them with NAC, or we want NAC, or we want to detox them with glutathione, or we say, eat a lot of broccoli sprouts. They will get worse.
They will get worse.
They will get
Absolutely.
worse, and you'll know it. And the parent will say, okay. And, they might not do great with onions and eggs and some of the sulfur foods. So when we address these things and we diagnose, people feel a lot better.
Yeah.
But I think for our patient population, the dysmotility is kind of the trigger, and it's really common. Also probably mold toxicity because it affects the bile. And
Right.
when you're not releasing the bile efficiently or the bile's toxic, the pH in the gut gets affected, and that has been shown to cause SIBO.
Right.
And then another big one that I think is a pearl with SIBO is it prevents T4 to convert to T3.
Interesting.
So you will see really weird thyroid function testing. So, and that won't make sense oftentimes in these patients as well. It's not just selenium. You need selenium to convert T4 to T3, and people will like, oh, take more selenium. And then I'll say, oh, let's look for SIBO.
Right. Interesting. I'll have to look at that in a couple of patients. That sparks a couple of pearls for me. But we've already talked about, addressing the bacterial load, the antimicrobial herbs, the biofilm, not overdoing the probiotics, the diet we've talked about. But the other piece in improving the gut motility is also the vagal nerve. I am a big believer in chiropractic, physical manipulation, any way you can help that. But do you want to talk about the vagal nerve just a little bit?
Yeah, so there's those physical strategies, like you mentioned. There's also things like vagal nerve stimulators. I haven't had that much experience with them. I was using those, like that Nemchek TENS unit. I didn't really, then I even tried TENS unit on the gut to help with motility. I do like the percussor, the like little vibrating percussor, like the sharper image one and the upside down U, because they need a prompt, especially with my apraxic kids. They do need a prompt in their gut. Like sometimes they need prompt for the speech.
Right.
They need that prompt. But, the vagus nerve is acetylcholine or cholinergic related, and the opposite is sympathetic drive, which is adrenaline. So addressing that kind of vagus nerve, I would use the term dysautonomia.
Yeah.
So dysautonomia would be, too much sympathetic, not enough parasympathetic. And my goal then would be downregulate sympathetic and upregulate parasympathetic using vagus nerve type strategies and different cholinergics. In the gut, I like the Thanacol as a med. It helps with those, receptors. I like that one as a med, and other strategies to help increase choline in the body. Methylation is probably the number one thing that makes choline. So getting our methylation strategies in place. Also with those motor complexes, getting mitochondrial function working well because you get that motor push with the mitochondria. And then kind of helping sympathetic tone with some like adrenal or adaptogenic herbs can be helpful too.
Yeah, so agree. And just for anybody who doesn't know, the parasympathetic system is that sort of rest and digest, that sort of calming, whereas the sympathetic is more that, sort of that that fight or flight. So we're trying to help the vagal nerve in every way we can, acetylcholine, et cetera, to be more balanced, I guess I would say, in these kids, because it is so imbalanced and
Oh
so
yeah.
toward the fight or flight end of
Yeah.
things.
Because when
I
you
think our
have a
whole
chronic,
world is these days.
yeah, I feel like we get really bombarded and,
Yeah.
we won't go into screen time, but it's a constant hit to that sympathetic nervous system.
Yeah.
And
Yeah.
then you got to do things to upregulate your parasympathetic. And I think we forget, to take that walk outside, to take those deep breaths.
Yeah.
A lot of our kids will stim, and sometimes I'll tell the parents that's their way of getting their vagus nerve to get stimulated a
Exactly.
little bit. Those are vagal like movements.
Yeah. I had a young woman recently who had been a non-speaking young woman for many years, and she always hummed. I never saw her parents never saw her without humming. And sometimes it would become screeching or loud humming, but there was always a low level. And it wasn't until she went through the spellers program and learned to communicate through spelling that she was able to say, listen, that's the only thing that calmed me down. And she was balancing her vagal nerve, this fight or flight, her whole life, because she
Mhm.
didn't know how else to deal with the frustration of not being able to communicate.
Oh yeah, I had a
And as
patient
soon as she could, she stopped humming. Go ahead.
Yeah, I had a patient yesterday who's also a speller, and he had like he was listening to music the whole time he was talking to me. Well, not really talking, but
Yeah.
communicating with me.
Yeah.
And so I said, "Oh, do you need the music to keep you focused so you can talk to me, you can communicate with me?" And he spelled yes. So it's kind of like it probably does something auditorily to kind of calm down that sympathetic nervous system a bit.
Yeah. Yeah. All right, so back to PANS pandas, and not just PANS pandas and autoimmune diseases like that, but all neuropsychiatric symptoms, anxiety, OCD, all of that, balancing the microbiome is so important. Can you just talk one more time about how that affects those neuropsych symptoms?
Yeah, so as we mentioned, a lot of our neurotransmitters, if we think of those brain chemicals, we think of the brain, but we don't always think of the gut. And
Right.
so again, in PANS and PANDAS, when I think of that, I think, okay, glutamate is a big
Yeah.
one. And glutamate, when I think of glutamate, it's so excitatory and it breaks down into GABA. Well, a lot of the bacteria in our gut stimulate GABA receptors. They did studies in mice where they cut the vagus nerve. They didn't get stimulation of GABA in the brain.
Right.
So there is this crosstalk with not just acetylcholine, but GABA in the brain. So they even did studies with like different probiotics and pain reception. And so the probiotic that you take doesn't colonize, it doesn't grow, but
Right.
it does stimulate these receptors. And there's a ton of receptors for stimulating GABA, and that's calming, it's relaxing, it helps with anxiety. And it's the opposite of glutamate. And glutamate is excitatory, it gives you a good memory, but you can get stuck in those memories. And
Yeah.
I think of glutamate, I use the key word loop. If
Yep.
if you're looping and you get stuck and you just can't get out of that loop, think of glutamate. Think of
Yep.
glutamate.
Yep.
And then the other neurotransmitter, dopamine. So there are these bacteria that inhibit the breakdown of dopamine. And
Mm.
that's the enzyme is called DBH and
Yep.
dopamine beta hydroxylase. And then we'll have high dopamine and low norepinephrine. And that high dopamine kind of makes you a little OCD and a little irrational.
Yep.
And the low norepinephrine makes you not have attention. And so a lot of that's really happening in the gut. And so if we
Yes.
can recognize that, oh, I have ruminococcus, enterococcus, streptococcus, clostridia, these are inhibiting DBH, I need to kind of address them. And it's not just about killing the bugs, it's about really balancing the microbiome. But
Right.
there's so much with the neurotransmitters, so anxiety, depression, OCD, that's sitting in the gut.
Yeah. Yeah. And, I just think talking about the gut and helping our families see its importance is this isn't just about infections. This isn't just about neuropsych symptoms. But if we get back to the root, which is the gut, we'll learn so much more about how this works and also be able to help our kids,
Yeah.
you know.
Yeah.
Well, Anju, you are such a wealth of information, and I could talk to you for hours and hours and
Same.
just furiously take notes and all of that. And we'll see each other again soon. But are there any last words you want to leave our families or practitioners with that you think it's important for them to remember?
I think that they're really having to deal with a lot these days. It's
Yeah.
just a lot being bombarded. And to take care of their vagus nerve,
Yeah.
maybe a little bit extra.
Yeah.
And also, um, don't be so hard on yourself. You'll get there. You'll get there.
Yeah.
And it's a marathon. We said it's a marathon. It's maybe a couple of marathons, and it's not a sprint.
Yeah.
But it's a learning process. And I call our doctor means teacher.
Yeah.
And my kids are my doctors because they have
Yes.
taught me so much. And I call my patients my kids, and
Yeah.
they teach us as parents and as practitioners so much. And, some of us with those kinds of beliefs, we kind of spiritually believe they're here to teach us. And let's
Absolutely.
learn our lessons and let's move forward and let's leave the past behind us.
Yeah. Yeah. Well, thank you for being such a great teacher, and such a
Oh,
great doctor,
thank you.
and for listening, because that really is, as Sid taught us, if you listen, they'll come. And we both learned so much from the families. And I hope for the practitioners that are listening, that's one thing you take away. Just listen, just be present, because these kids can get better, but we need to be present with the families with all they're going through. So.
Oh, yes.
Yeah.
Yes.
So thank you for always doing that. And thank you for being with us. And I'll see you
Oh.
again soon.
Oh, it was my pleasure. Thank you for having me, and thank the audience out there for listening as well. Thank you all for being here.
That's it for today's episode of Demystifying PANS, PANDAS. I hope you're walking away with insights, tools, and hope to help you and your child on this journey. If you found today's conversation valuable, be sure to subscribe so you never miss an episode. Share this podcast with anyone who might need it. It could be the lifeline they're searching for. And if you have a moment, leaving a review helps us reach even more families who deserve answers. Also, for more information, training, and community, check out our website, drohara.com, and join our annual membership. And remember, every step forward, no matter how small, brings us closer to healing and understanding. Until next time, be present, be hopeful, and we look forward to seeing you next time on Demystifying PANS, PANDAS.